Thank you very much. For those online, my name is Adrian Dix. I'm BC's Minister of Health. I'm honored to be here on the territory of the Lekwungen-speaking people of the Sanghees and the Esquimalt First Nations. It's an honor to be here on their lands. I want to thank you for joining me today. Today, I'm here to announce that effective immediately, the province is introducing a new regulation to ensure that diabetes patients in BC do not experience a shortage of the drug called semaglutide, otherwise known as Ozempic, and sold under other names as well. Specifically, under Section 23 of the Pharmacy Operations and Drug Scheduling Act, a new drug schedules regulation has been enacted to impose conditions on the sale of semaglutide by pharmacies here in BC. The purpose of this regulation is to protect supply of and patient access to semaglutide drugs that treat type 2 diabetes. Semaglutide is in the class of medications called incretin mimetics that help the pancreas release the right amount of insulin when blood sugar levels are high. Effective today, these new regulations will restrict the sale of drugs with the active ingredient semaglutide used to treat type 2 diabetes under the brand name Ozempic, an injectable, and under the brand name Rybelsus, a tablet. This regulation will also restrict a drug used to treat obesity using the active ingredient semaglutide under the brand name Wegovy, an injectable. The new regulations will help prevent any new online or mail order sales of semaglutide to people who do not reside in Canada and who are not in BC to make the purchase. The BC College of Pharmacists will be responsible for ensuring its registrants comply with this new regulation. I want to thank the college for its commitment to working with the provincial government to ensure that all new regulatory requirements are met and that practice standards continue to be followed by every pharmacist in BC. I would also obviously like to take the opportunity to put what we've announced today in context. In January, you will recall, we provided limited coverage for Ozempic as a second-line therapy under pharmacare for type 2 diabetes patients to help manage blood sugar levels. We also know that Ozempic has become and is, through significant advertising and social media and comment on the drug, a drug of huge interest to many people across the world and across North America. Ozempic, I should note, is not currently approved in Canada to treat obesity. It is only approved to treat type 2 diabetes. While BC does not currently have a shortage of Ozempic, this side effect has caused a surge, this impact of the drug and its use by some to lose weight has caused a surge in demand for the drug, resulting in shortages in other jurisdictions. As you'll know, and as I announced 3 weeks ago from this podium, we saw a massive surge in dispenses to U.S. residents from 2 internet pharmacies in BC. They were responsible for a full 13,197 of the 15,798 dispenses, representing 88% of all dispenses to U.S. residents of Ozempic in January and February of 2023. Increasingly, U.S. customers were turning to Canadian online pharmacies to purchase drugs at prices lower than can be obtained domestically in the United States. This is concerning. We do not bring Ozempic to British Columbia. We do not bring drugs to British Columbia for them to be re-exported to the United States in response to whatever advertising campaigns might be put in place or word-of-mouth discussions. We do not do that. The United States, of course, can take decisions to address issues around the price of prescription drugs in the United States. That is their affair and their democracy. But here in Canada, we have to protect the interests of BC patients, those who need this drug and other drugs here in British Columbia. I've asked, as you know, 3 weeks ago, I asked the BC College of Pharmacists to review this issue, and that review is underway. They provided information, and the province provided information to the province of Nova Scotia. The College of Physicians and Surgeons of that province suspended on an interim basis the license of a doctor who was responsible for 17,000 prescriptions for Ozempic in 3 months. A doctor registered in Nova Scotia, licensed in Nova Scotia, but living in Texas. And I thank them for their quick action. They responded, I believe, within 48 hours of us providing them with the information. We appreciate their support and the support of the Minister of Health in Nova Scotia. The action I've taken today is to introduce the new regulation limiting the sale of semaglutide drugs to non-Canadian residents. And it is an important step. And it's one, by establishing the regulation where if this were to occur with other drugs, we could add such drugs to the list. This is a legislative and regulatory response to a real problem, the difference in drug prices between Canada and the United States, and the absolute need to support our patients in British Columbia when drugs are obtained to serve the patients of British Columbia, whether it's for type 2 diabetes or anything else. So this action will address this problem of these pharmacies and this situation in British Columbia. And we will be reporting to you before June 30th of this year with the numbers that demonstrate the effect of this regulation. But I believe the situation that we saw in January and February will be absolutely changed in these 2 months. And we will report on that to you, and you'll be able to see that. That said, this is a broader problem in our country. I appreciate and discussed this issue with the Federal Minister of Health, Jean-Yves Duclos, last week. He was extremely supportive of British Columbia. We appreciate his support. He expressed strong views about what had been going on and went on in the case of this doctor and these circumstances. But I think this situation for Canadians from coast to coast to coast requires national action. We can deal with it in British Columbia, and we are. The federal government has suggested that pharmacists are regulated provincially, and that is the appropriate place for action. But this is about the international trade of products that are of essential need in Canada. There is a significant federal role here, and I have again written to my colleagues, including the Federal Minister of Health, to ask us to take joint action to address the underlying issues here that are not just about Ozempic, but are about the availability of prescription drugs in Canada. We work hard as a province to get the best deal for prescription drugs for residents, the broadest access to pharmacare, and that's included recently, as you know, the expansion of free contraception in our province. We are committed to that, but we have to work together to act in good faith to ensure that patients in Canada have access to the prescriptions drugs they need, whether it is in the moment Ozempic or in the future for other drugs. That's why we've taken the action today. 3 weeks ago, we said we were going to do these things, and the regulation that has been put in place by ministerial order is in place as of now. I look forward to taking any questions you might have.
A reminder to media on the line, please press *1 to enter the queue for the opportunity to ask a question and a follow-up. We will start in the room with Richard Zussman, Global News. Richard, a microphone is coming around to you now.
Obviously, those drugs are being used. They're injectables and they're being used. So what has happened has happened, right? What I said I needed to do was make sure it doesn't keep happening and it doesn't happen again so that we have access to this. Drug companies are not going to send us. We don't have enough drugs in British Columbia, or prescription drugs, nor would we expect to serve the U.S. market. And drug companies are not going to allow us to maintain low drug prices and based on negotiated agreement. The reason they're lower is we have public health care in Canada, and they have, in the world sense, a slightly eccentric mixed system in the United States. Let's put it that way, put it mildly, particularly in terms of these regulations. And I might have comments as someone who spent a lot of time looking at prescription drug policy about what they should or shouldn't do in the United States, but that's surely for Americans to decide. Right? So we can't get the drugs back that were sent, right? They were sent, and we'll see. There's a review. I'm not going to comment on the conclusions. We know the conclusions of the Nova Scotia College, at least initial conclusion, which was suspend the license of a practitioner, because there's the issue of prescribing and whether it's reasonable that 17,000 people were prescribed for one drug by one doctor. I suggest it's not. That will be for them to decide. Or it's reasonable that this business model exists or existed here in BC, and whether that was consistent with the law. What I'm saying is it won't happen anymore because I don't think it's reasonable. It won't happen anymore. Shouldn't happen anymore. And for it to continue to happen, for us to turn a blind eye would mean that we were essentially putting at risk the system of prescription drug distribution that we have in our country. So I think, as I noted, the federal government should play a role. You'll all recall during COVID-19, they played the role of getting, for example, in that case, vaccine, and we delivered them. This is work we've done together, and they did it because they can go out in the world and represent the whole country and get both the best possible deal and the best amounts, and we did that process there. And so I think they have a role here because I just don't think it makes sense for us to have a lower prescription drugs laws and then try and get around or serve as some sort of workaround for people looking for low drug prices in the United States. It's not a sustainable model, and I think if you ask any pharmaceutical company, they'd tell you that as well.
Is there a threshold to add other drugs to this list? Considering there's a price gap here, these things may happen in other circumstances and may have already happened. So is there a threshold of how much must be purchased from the U.S. in order to be put on this list?
Well, one of the advantages, and I just repeat why we'd want the federal government to be involved. One of the advantages we have in BC is we've had a PharmaNet system really in place in BC since 1993. So we have broad information and understanding about dispenses of prescription drugs, essentially dating back 30 years in BC. So we have the means to observe the system, see what's happening, and respond when required. I think the demand for this drug and the advertising right now around this drug and the interest in this drug is unlike any other drug that we see. But yes, this allows us, should that change. And remember, there are, in British Columbia, just to give you a sense, there are hundreds of thousands of people with type 2 diabetes in British Columbia. Setting aside the off-label use for weight loss, these are drugs in significant demand here and elsewhere. One of the challenges with Ozempic as a drug is it's an injectable, so it's not just an issue of the supply of the drug itself, what's inside, but also the equipment around it, which has led to some of the supply issues, as I understand it, and just the extraordinary demand for that drug. So I think that we will be looking at that. But what this does, this regulation does, is it allows a Minister of Health in future to take action should such a situation develop. And this is an area of, I think, of public health care where we have both excellent data and the means to respond. So this is a response to the new situation. I do think the issue of internet pharmacies, though, again, is one that the federal government will have to look at as they go forward, because I don't think there's anything wrong with dispensing through the internet if all rules are followed to Canadians. But sending tens of thousands of doses to the United States, that doesn't make any sense.
Our next question comes from Mira Bain, CBC.
Hi. So, Minister, what is the price difference between Ozempic in the U.S. and buying in BC?
It can be different in different places. We can provide some information on it, but it's significantly cheaper here. Remember, it's also covered here. So one of the reasons why prescription drugs tend to be cheaper in Canada is that we both bulk buy and negotiate, our provincial governments collectively negotiate with pharmaceutical companies. So we tend to have lower prices across the board. There's some information on that, what we could provide, but it's significantly lower. But it's not just a question in this case of price, it's also an issue of supply that led, I think, to that. So we talk about interest. There's an extraordinary interest for Ozempic. Supply, there were some limits and there's some shortages for some classes of the drug, even in Canada, right? And so there's that, and then there's price. And the price differences have existed for a long time. And only 1 out of every 250 dispenses on average in British Columbia goes to the United States, right? So those price was not just an issue of price. I think it's a coming together of all these factors. But there are significant differences in the case of a number of drugs. A lot of our negotiations for higher expensive drugs, of course, are kept confidential when we negotiate for expensive drugs for rare diseases because of the nature, and frankly, we get a better deal for people that way and are able to provide more access. But there is a significant difference, and we can provide you some information on that.
Sure.
A little bit within U.S. jurisdictions on different prices. So.
And in terms of some of the advertising around Ozempic and some of these semaglutide drugs, is the BC government looking at also regulating that? Because some of these ads, you can't tell exactly what they're even for.
Yeah, I think, is it Pilot that did the tune Magic? It's Magic, I think that's it's a 70s tune anyway. So perhaps, well, I won't say who might know about that. I won't say who might know, but I know about that. That's absolutely a federal issue, advertising for prescription drugs. And I've expressed my concerns about that in the past, because remember, you're advertising for something that isn't directly dispensed. It's not like advertising cornflakes against bran flakes, and they're, arguably tastier than bran flakes, and bran flakes might be better for you. And then you go to the grocery store and you decide these are prescribed drugs, right? So what the ads tend to say, and they're different in the United States, and there's a conflation here, right? Because in the United States you see the banner, this percentage of weight loss or this amount of weight loss. In the US ads, where there's different rules, we get that off air. Not everybody watches Global or CTV or the CBC. Sometimes they watch ABC and NBC and CNN and so on. It happens. So you have those two phenomena, but it is a Canadian. There have been changes in Canadian policies, and this does raise issues around that, right? Because again, there's a lot of brand recognition, but there's also a lot of, and this is what makes it challenging to regulate, a lot of influencer, a lot of online action, a lot of interest in the drug, which isn't just the result of the advertising, which has been a significant campaign. I mean, you see it, I tend to see it because what I tend to watch on BC is basketball games, emboldened on the court at Raptors games, and there's a lot of Ozempic ads, and I can't get the tune out of my mind now for Ozempic. I'm not going to repeat it here because I think that wouldn't be good for anybody, but it is a federal issue, and I think it's reasonable to ask again how much advertising and what kind of advertising is appropriate. There are rules around that, and that's something the federal government always needs to review and look at as they do this issue of export of prescription drugs.
Next question comes from Wolf Deppner, Black Press.
Thank you for taking my question. Minister, to build on the question of my colleague, what, if any, financial information can you share about the value that the province has in terms of contracts with companies that provide these types of drugs?
Well, I don't have information to share on that. I think what a company would do, and they distribute through pharmacy in BC, is they provide an appropriate amount of drug for the BC market. When we covered this as a benefit under pharmacare, that increased, and that's why the percentages are important, it increased the demand in BC because it's a relatively expensive drug for everybody to buy outside of a pharmacare plan. So for those who need it, type 2 diabetes, making a second-line treatment under pharmacare was very important. So, but this drug, and believe me, there's lots of information about this drug, is, of course, both important as a treatment for type 2 diabetes. And again, depending on their estimates, certainly between 300 and 400,000 people in BC deal with type 2 diabetes. So you think of it, I have type 1 diabetes, which is about 30 to 35,000, just to put that in context. How many people deal with this? It's obviously an important drug, and these drugs are important in the treatment of type 2 diabetes. The first line drug is a drug called metformin, which has been in place and been available for a long time. It's in fact a generic, and then this is the second line treatment drug. So the issue here is twofold. One, if we just let this go, then and we're allowing, and we see this level of growth, presumably the majority of there would have been no limit really, or very little limit to the share of the BC available market for Ozempic that would have gone to the United States, right? We had a price advantage, it was easy to distribute, and it was happening. And there were apparently people willing to prescribe at a level of 17,000 prescriptions in 3 months. So there was opportunity for that. And that's why we're taking the action now, because the assumption would be, not that we have a shortage now, because we don't immediately, but that we would soon arrive at that point and that the company, in this case Novo Nordisk, would not accept a situation where they're sending us drugs so that we could undersell them in the American market, something that's not a realistic option. So you're asking, is there a lot of money involved in this drug? There's a lot of money involved in this drug and a lot of interest. And it's why we have to take strong action to protect British Columbia residents. And we're asking, I'm going to join with other provinces and the federal government to take strong action to protect Canadian residents. Because, it's this drug today, there will be other drugs, even in the space of type 2 diabetes. There's a new drug by another drug company now that's that I see advertised on TV as well. That we may need to take this similar action.
Let me try a different way. What, if any, estimates are available that would allow the public to quantify how much of a loss to the public purse there would have been if you hadn't taken this action?
Wouldn't have been a loss to the public purse. It would have been a loss to the health of British Columbians. And that's the important question, right? That if you'd had a situation where you needed where British Columbians needed to access this drug and it wasn't available, and for example, you'd made the transition onto Ozempic as a drug to treat your type 2 diabetes, and then it was suddenly unavailable, that would be a health impact, and that's just completely unacceptable. So in terms of the purse, because there would have been less Ozempic, the pharmacare program, for example, in our coverage of that, less Ozempic available, less dispenses, less cost potentially, right? But the health impacts, we would have had to address the health impacts, which itself would have had a cause. Our goal is to make sure Ozempic's available and potentially other drugs are available for people in BC who need those drugs. And that's decided ultimately through the pharmacare program and all the pharmacists and doctors who inform that program, but ultimately by prescribers in BC providing under conditions that those prescriptions. It's also a serious drug. I just say to people who use drugs for off-label purposes, right, that people need to act, I think, in terms of their own health and taking drugs that maybe you don't need. As someone who takes prescription drugs 5 times a day to treat my diabetes, if I didn't have to do that, I don't think I'd want to do that. And I just say to people out there on the broader issue that this is, when the ads say it's consult your doctor. Yes, absolutely. And if you don't need to take something, don't take it.
Our next question comes from Dirk Meissner, Canadian Press.
Hi, Minister. Hey, so healthcare provincial issue, but the regulation you put in today, do you think the feds could put a nationwide regulation like that in?
It would be under a different act, but yes, I think national action is taken, and it is in fact taken in the specific way in other areas for distributors, for example. The federal government's argument is, and I met with Minister Duclos on this, is that this is pharmacy is provincially regulated. And the issue point is, what happens when there's a massive market in the United States that wants our drug, and who's responsible? And I think Minister Duclos has been very, very supportive and is very inclined to work with us on it. So this is not a criticism, but there's clearly federal jurisdiction here. There is already. And the College of Pharmacists, of course, regulates pharmacists. There are all these provincial statutes that regulate pharmacists. We're talking about, in this action, an action of prescribing for someone in the United States, right? So that has implications for doctors and implications for pharmacists. We don't want to confuse questions. There is no problem with the prescribing of Ozempic or any other drug that I'm aware of by British Columbia providers. No broad problem. There may be individual problems from time to time, but there's no broad problem. Our College of Physicians and Surgeons and our doctors are as appalled about what they saw in this thing as anyone else. So this doesn't reflect them, doesn't really reflect it doesn't reflect our pharmacists either. In fact, we've had nothing but support on this question from them. But, there's a federal role here. This is the international trade of a valuable product to BC patients that is significant for their health and Canadian patients. I think there's a federal role here, and I think we can work out under the Food and Drug Act how we would do that together. And so what we're saying is we'll work with the federal government, support the federal government in this, and I must say that Minister Duclos has been very supportive of us.
Okay, and there's a line in the the news release, so can an American, or say someone out of Canada, go into a BC pharmacy and get Ozempic?
Yes. So they have to be in person. And here's the point of this. And I made this point when I talked to you before. I'll just use my own example because it's easiest, right? I haven't left BC in a while, but at some point I may leave BC again. You know, we'll see. We'll see. January 2019, I think, was the last time. You know, haven't even been to Bellingham. You know, but I have gone outside the province, and when you have insulin, different people use different methods. I still use a vial for my short-acting insulin, and you go in, you can drop it, and it can break, and then you need to get the drug in the United States, right? There's rules around that, rules around Canadian prescribers, and you see why it's someone licensed in Nova Scotia that was doing this prescribing from the United States. We got lots of Americans in BC, lots of people here on business. We depend hugely on tourism, and we want people to come here from them. So we don't want people, if they need a drug here, to be able to go into the pharmacy with the appropriate prescription and get that drug for themselves, whether it's insulin or Ozempic or anything else, right? So that's why the rule's in place. The issue here isn't people coming to Canada as tourists or as others and needing access to a drug. And you might argue there's some cross-border trade, but really it's border trade, and there's not a lot of that. This was the mass sale by the internet of a prescription drug we needed. So that's the significant aspect here, right? Which is, and that's why we've taken this action today. So we don't want people to say we're coming to BC, because of course Canadians travel to the United States all the time, and with the appropriate prescriptions and so on, they should be able to get access themselves to drugs needed by them at that time. These are prescription drugs; they're needed by people, and sometimes drugs are forgotten, drugs are lost. You're there longer than you expect, and you need to access that. So we don't want to stop Americans from being able to get their prescriptions filled when the documentation is appropriate and everything else in Canada, and that's why this is directed essentially at online sales.
And we have another question in the room before we go to the phones. Les Lane, Times columnist.
So you extend coverage in certain limited situations for diabetics in January, and then 2 months later, the numbers, you find this fascinating little tale of 2 Vancouver pharmacists selling 13,000 prescriptions in 2 months. And I'm curious how this was revealed. Did those numbers just jump out of the system at people in pharmacare, or did they go looking for it?
I asked.
How did this?
Well, I'll tell you specifically. So we announced the extended coverage for Ozempic in January. It had been a public issue before that. We've been raising the issue. Endocrinologists in Vancouver have been raising the issue, and we're looking at extended coverage for the drug. I'm personally, and this is a fault of mine, excessively interested in prescription drug policy. And I was interested in the subject of this drug and what was happening with it, because there was a lot of demand for the drug and a lot of hype around the drug, and you know all about that. And so at the time, we learned that 9% of Ozempic dispenses in BC, this was in January, right, when we made the announcement, were going to the United States, which was 22 times more than the provincial average, right, which is 0.4 of 1%. So what I said at the time, and I asked, and this happened, that we look at this over the next 2 months. The issues are not linked. Like the pharmacare coverage in BC is not linked to the dispenses to the United States, where obviously the pharmacare coverage doesn't apply. But I was concerned about the 9% and what was happening with it, given the interest in this drug internationally. And we did review it over the next months, and we're asking that question consistently. And in the months January and February, which followed that announcement, that went from 9% to 15% of all dispenses and 18% of all recipients of the drug in BC were U.S. residents. And that we determined, of course, by observing that almost all the dispenses were coming from 2 pharmacies, and they were coming from doctors in Nova Scotia. And that's when we decided to take action, that we couldn't continue to have this situation. So the issues are linked because we worked on them together, and they came out of the same process. But one of the advantages we have in BC is a PharmaNet system, which is, I think, the envy of the country. Not all provinces have this in the same way, this ability in the same way. So it allowed us to see a problem, review it over a period of time, learn about it, and take action. And action was taken in Nova Scotia, in British Columbia, and now today we're not going to allow the practice with respect to semaglutide.
What's the right word to describe this whole scheme? It's not illegal. It looks incredibly sketchy. Is it unethical, or is it just wrong, just on the point that it's BC drugs that are going elsewhere? How would you characterize this shortly?
It is a scheme. It hasn't been determined yet whether it complies with the law. We know that Nova Scotia has taken action because realistically, when you think of what your doctor goes through to prescribe a significant drug, and then you imagine 17,000 dispenses in 3 months, I mean, on the face of it, it took them basically 24 hours to say, we need an interim suspension of this license. Like, that strikes me as a problem. The distribution is a problem as well, right? This isn't, so I think it's a scheme. It hasn't been determined whether the actions of those involved in the scheme were consistent with the law. But in any event, the law had to change, and the law changed today, and we're not going to allow this with respect to Ozempic anymore.
Why did they pick BC over the drugs?
I don't know. I mean, that's not, in Canada, and this is why national action is required, right? Because, this protects BC, and that's my job to protect BC, you could say. I think there's a national issue here. You don't want to be playing whack-a-mole, where they find, a pharmacy that can do this in another jurisdiction, and a doctor who's prepared to engage in these, let's call them practices, in another jurisdiction to do this. So from my perspective anyway, that's why national action is required as a Canadian and as someone who thinks that these issues are important. And the broader issue is, I think Canadians can be proud of their public healthcare system. And to some degree, the American presence in healthcare is distorting to Canadian healthcare, the way they engage in the decisions on these issues. To some degree, it's distorting. And as you know, 4 states have put in legislation of one form or another that allows them through to really import drugs for Canada in this way. And I just think I think they do have an issue. And I think they should resolve that issue in the United States, but we can't do it for them. And if we continue to allow, through schemes like this, that to happen in a systematic way, and I'm not talking about a few people might come in, I'm talking about thousands of a drug that is in relatively short supply at the moment, then we're not going to be able to sustain what we have, right? Which is a public health care system and a pharmacare system that, while not universal, is important to people who need it.
Time for one more question today. It comes from the phones. Benoît Ferradini, Radio-Canada, please go ahead.
Bonjour, Monsieur le Ministre. Est-ce qu'on pourrait avoir en français votre annonce faite aujourd'hui et qu'est-ce que vous avez changé pour l'accès aux médicaments Ozempic?
Oui, on a mis en place une nouvelle loi à ma direction sur l'ordre ministériel qui va empêcher l'exportation d'Ozempic, de Rybelsus, de Wegovy, à des gens qui ne sont pas canadiens ou qui ne sont pas des résidents permanents et qui habitent hors du Canada. Donc, on a fermé la porte à l'exportation massive d'une drogue, de la drogue semaglutide.
Ma deuxième question.
Oui.
Le vapotage au Québec, aujourd'hui, on vient de voir que le Québec voudrait restreindre le vapotage et notamment les produits parfumés destinés aux adolescents. Est-ce que le vapotage chez les jeunes vous inquiète en Colombie-Britannique et est-ce qu'on pourrait avoir le même genre de décision ici?
Nous avons mis en place et c'était avant la pandémie, la vie avant la pandémie, quand même, on a mis en place un plan compréhensif contre le vapage par des jeunes en Colombie-Britannique. On a pris une action compréhensive et je soutiens la province du Québec qui prend de l'action qui est à peu près équivalente, mais nous avons la réponse la plus compréhensive au Canada. Avec le vapage, on a travaillé fort avec le gouvernement fédéral qui a mis en place ses propres règlements au Canada. Et je pense qu'on a déjà mis en place des restrictions à la vente des produits de vapage parfumés. Et je soutiens l'effort de mes confrères au Québec de faire de même. Merci
Very
beaucoup.
much.
Thank you very much.
That concludes today's event. Thank you.